Hello, everyone. Good afternoon. Welcome to our webinar. Today, we will be talking about everything you need to know about LASIK, PRESBYMAX LASIK, and Trans PRK. So today we are joined by Dr. Heredia. He is the head surgeon at Borough Center for Sight. Also joining the discussion will be Dr. Jerome Sarmiento. He is a LASIK specialist at Borough Center for Sight, and he has 25 years of experience with laser surgery. So without further ado, Doc Chess, the floor is yours.
Dr. Jerome?
Hello everyone, and welcome to our ever first webinar. This is a series of webinar with the public, and of course our speaker is a good friend, Dr. Heredia. He finished his College of Medicine at the UST College of Medicine and Surgery, had his residency at St. Luke's Ophthalmology way back, and we were together. I'm just a couple years ahead of him. And with much further ado, welcome Dr. Heredia.
Thank you, Dr. Jerome, and welcome to everyone to our first webinar of 2021. And before I start, I'd like to say advance Kung Hei Fat Choi. Tama ba yan? So we are, I think, in the eve of Chinese New Year, the Lunar Year. So that's very, auspicious for us. So, and very timely because now, we have invited people and we want to know more about LASIK. So, and very special portion here is PRESBYMAX LASIK, which a lot of you have just heard of. And of course, we will talk also about Trans PRK. Yeah? So just an introduction. Before we go into these things, we need to know what is happening to the eye. So the next slide, please. So this is a basic anatomy of the eye, just very quickly. So from the front part to the back, our normal eye should measure around 22 millimeters. No? And the errors of refraction stem from that. So for example, the most common one is myopia. Next slide, Mitch. So it's an elongated eyeball, so more than 22 millimeters. So the images fall before the retina. Therefore, we need minus lenses to refocus onto the retina, right? So most of the people who are nearsighted will use minus lenses. Next slide. Next is hyperopia, too short an eyeball, less than 22 millimeters. So the images fall beyond the retina, and therefore we need plus lenses to refocus the images on the retina. And there may be a mixture also of stigmatism, next slide, which complicates the matter even further. This is the irregularity of the cornea. It should be like a dome shape, like Araneta Coliseum, but the cornea is shaped like an American football. There's a steep area and there's a flat area. And therefore, it adds to the blurring of the vision. And usually, there are a lot of people with combined nearsighted and farsighted combined with astigmatism. So next slide. And of course, presbyopia, which we are already suffering from. If you are age early 40s to mid 50s, presbyopia is the inability to focus for near. Whether you are nearsighted, farsighted, or astigmatism, doesn't matter. When you reach age 40, early 40s, your lenses are not unable to focus, start to lose its ability to focus for near. And therefore, we will need reading glasses or bifocals, or as the popular ones now are progressive lenses. So these are the errors of refraction that we are going to deal with. And the surgical solutions are as follows, no? Of these errors of refraction. So in our center, Borough Center for Sight, we specialize in LASIK, Trans PRK, PRESBYMAX LASIK, ICL, and refractive lens exchange. But today, just for a webinar, we will be talking about the first three, which is LASIK, Trans PRK, and PRESBYMAX LASIK. Next slide. So LASIK is short for laser in situ keratomileusis, which basically has three steps. No? Number one is the most important step, which is the creation of the flap. And number two, which is equally important, is the reshaping of the front part of your eye with an excimer laser. And right after that, the flap is repositioned. So we'll show a short video now on what LASIK is. Mitch, there's no volume, please.
We may have to narrate. I guess we lost the audio.
Oh, doon na lang.
Yeah, I don't we just narrate.
Okay.
Okay.
So here it is. You lie underneath the laser,
Mhm.
and then of course there's anesthesia eye drops to numb your eye. So the surgeon will now position your head and your eyes underneath the laser.
Or closing your eye during the procedure.
Okay.
The LASIK procedure consists of 2 steps. The first step is creating the flap. To do so, your doctor will separate the outer layer of the cornea, the clear front window of the eye. Your doctor will then gently lift this flap and hinge it back out of the way in order to expose the deeper layers of the cornea. At this point, you may feel some mild pressure over the eye and your vision may dim and become blurry. The second step is performed by a laser that will reshape the cornea for your specific prescription. You might see a blinking, fuzzy light. Your doctor will ask you to look straight ahead in order to precisely align the laser beam with your eye. When everything is just right, your doctor will activate the laser. Computer-controlled laser light pulses will remove microscopic amounts of tissue, gently reshaping the cornea. The pattern of laser treatment is determined by a sophisticated program and based on the detailed measurements that were taken during your preoperative examination. The laser light is invisible, but you will hear a slight clicking sound as the laser gently reshapes your cornea. Because your eye will be numb, you will not feel the laser, although it is normal to smell a faint odor at this point. Before you know it, your procedure will be over, and the surgeon will gently reposition the flap, smooth it with a special medical sponge, and allow it to dry for a short time. You will receive a shield or sunglasses to cover your eyes so that you do not accidentally rub them. Ask us if you have any questions about the LASIK procedure.
So that's it. Very quick. Now we talk about the flap. In our center, we believe that the keratome or the mechanical way of creating the flap is a better choice than a femtosecond laser. Other centers will offer you the femtosecond laser created flap, but we have gone through that in the years past, and we feel that the keratome is superior in many ways. Number one, it is cheaper. It's you no longer need to maintain another laser. We feel that there are less flap complications with the keratome, especially with our new keratome, which is a 4th generation keratome. Flap is very fast. Flap creation is very fast. In a matter of 10 seconds, 10, 15 seconds, we have created the flap. And studies have shown that the flap's stromal beds are smoother with a blade or a keratome over the laser treatment. So, and the most important here is that it's very convenient for the surgeon. It's very easy to perform. It's very easy to handle, and therefore it also translates to convenience for the patient. And ultimately, it translates to better vision and results for the patient. Next slide. So these are ML7 keratome. So we can vary the hinge, superior, inferior, depending on the choice of preference of the surgeon. And we have as thin as 100 micron flaps. So we can accommodate higher myopia, higher treatments with this keratome. So we haven't seen a lot of complications with this keratome in the past few years that we have been using it. It's very safe. And for me, it's the best keratome. We have used many other keratomes, and this is the best keratome out there in the market today. And we are using it on your eyes to perform LASIK. Next slide. Of course, the other technology that's very important is our laser. This is our third laser in our experience with Dr. Jerome, and a very robust and superior laser. And very important is unparalleled customer support. Special mention to Mr. Wilder, who is here right now. And we make sure that the laser is working at tip-top condition every single day, every single moment. And so that there's no downtime, so that we can perform LASIK and treatments for all our patients. Of course, it's the market leader now in excimer laser. It's German technology all over the world. So more and more surgeons and centers are shifting to the Schwinn technology. And really, it's the superior eye tracking system. So it that translates to more precise treatments. So we've been using this for 2 years, and we're very happy to have this technology in our fingertips. Next slide. Next, we talk about trans-PRK. So again, we'll show you a short video. Go ahead, Mitch.
This trans-epi-LASIK presentation is brought to you by Boro Center for Sight. Have you been diagnosed with nearsightedness, astigmatism, farsightedness, or presbyopia? Are you tired of wearing glasses or contact lenses? If you answered yes to any of these questions, Boro Center for Sight might have a solution for you. There are a few different ways to correct your vision via laser. The first is LASIK, a procedure which reshapes the cornea to enable light entering the eye to be properly focused onto the retina for clearer vision. It is done by creating a flap in the cornea, lifting it, and applying a laser to sculpt a new shape, either decreasing the curvature of the cornea for nearsightedness or increasing the curvature of the cornea to correct farsightedness. The flap is then repositioned back to its place where it heals by itself. People who choose LASIK often have issues with dry eyes. And now we have trans-epi-LASIK, which is performed using the state-of-the-art laser, the Schwinn Armoris 500E, where in one seamless step, the corneal epithelium is removed, and then surface stromal ablation, or reshaping, is done for only 20 to 40 seconds per eye. A bandaged contact lens is then placed over the eye to allow healing of the epithelium, with minimal discomfort experienced by the patient, and is removed by your surgeon in 3 to 5 days. After this period, the patient should be enjoying very good vision, which continues to improve through time, as most patients reported that their vision is significantly better than before with glasses or contact lenses. With over 1,600 lasers and counting being used worldwide, more and more of the most trusted surgeons in the world are switching to this new Schwinn Armoris technology because of its exceptional results in delivering a better quality of vision. The new Schwinn Armoris is the fastest and coolest laser in the market today. With no heat generated on the corneal tissue, its surface layer creates a smoother ablation. It's touchless, with no surgical instruments having contact with the cornea, and it's safer, with lower chances of dry eyes after the procedure. Imagine doing all the things you wanted to do before, like playing active sports, experiencing convenience, and enjoying the world around you, all without glasses or contacts. Trans-epi-LASIK is safer, faster, and better than LASIK. It is a one-step, touchless, seamless laser treatment for clear vision for your eyes, and is now available at the Boro Center for Sight. Come for your trans-epi-LASIK screening at Boro Center for Sight at the second floor Wellness Zone, SM Mall of Asia, and discover how trans-epi-LASIK can change your life.
So yeah, this is also a new technology. We started doing trans-PRK, trans-epi-LASIK, in 2019. Very good results. Next slide, please. But the only difference, going back to LASIK, LASIK is very fast visual recovery. For those who already had LASIK, Takes 2 to 3 days, and you're back to 2020, 2015 vision. There may be glare halos for the first few weeks. Very slight discomfort only in the next until the next morning. And occasional dry eyes for the first few months is treated with artificial tears preparation. Rare regression nowadays with the new laser, but still there can be some enhancement that can be done in the future. After trans-PRK, next slide. Trans-PRK may take longer for healing. So it may take 2 to 3 weeks or even longer. Burning sensation for the first 24 to 48 hours after the operation. Personally, I had PRK when I had my eyes lasered, and I felt the burning sensation only for about 1 to 1.5 days, and it was gone. Other patients will have photosensitivity or sensitivity to light for the next few days. Others will have it for 1 to 2 weeks. But even for LASIK and trans-PRK, healing may continue for the next 6 months after the operation. The main reason why we shy away from trans or PRK in general is because of the haze formation, which can give blurred vision for some time, especially in eyes which have brown irises. So especially eyes that are Asian in the tropical weather. So haze formation is higher than with the Caucasian eyes in the cooler weathers, cooler temperature countries. So again, and also enhancement is also an issue. We need to do another PRK on top of the trans PRK if we need to do enhancement. So those are the differences. Basically, when you come to the clinic, we will see, we do a screening, and we will be the ones to recommend which is best for you. And usually patients will want very quick recovery times, so about 24 hours, not more than 1 day, the less pain, and therefore in our center we have opted to offer LASIK if you are able to do LASIK. If you have ample corneal tissue, then we will recommend LASIK. For those that are not good candidates for LASIK, then we can recommend trans-PRK. The next slide. So these are the main differences as what's already. So less pain, faster healing for LASIK, issue of dry eyes, maybe more for LASIK, but gone in 6 months. Haze formation can be an issue for trans-PRK, but long-term visual results are basically the same after 6 months to 1 year. Next slide. So we're also here to introduce PRESBYMAX LASIK. We have started doing this in August. And in fact, I was the first patient here in the picture. Dr. Jerome performed my PRK PRESBYMAX. The date is August 28, more or less 5 to 6 months ago. And I had astigmatism and I was wearing glasses. And we were able to, we were certified to do the PRESBYMAX LASIK in August. And I decided to be the first patient, and I have no regrets. 5 months after, 6 weeks after, I was seeing very clearly far and near. And I see weekly improvement, monthly improvement. And now I'm 6 months into my surgery, and I'm truly amazed about the results, and still enjoying and very happy with the results. So PRESBYMAX LASIK is the solution for those who are presbyopic in the age range of 42 to late 50s who cannot see near. They need reading glasses. They're tired of reading glasses. So now they have a chance to see again near without the need for needing glasses. You may be myopic, nearsighted, farsighted, astigmatic, or even just emmetropic, or those who have perfect far vision and only need reading glasses. PRESBYMAX can be for you. So the only thing is that when you have the laser, it needs some time for your brain to adjust to the new optical system of your eye. It may take 2-3 weeks for your eyes to adjust, and the improvement is daily and weekly beyond that. So basically what happens is very important, is that the dominant eye, which is usually the right eye for right-handed people, is targeted for far. So we do the laser treatment and make your right dominant eye your far-sighted eye. So very, very good far vision. And then your non-dominant eye, we target for near vision. So it's more like a blended vision. So in my case, my right eye is perfect, 20/20, even better, but my left eye is the one seeing near, and you can read my text and watch YouTube videos. So, but with both eyes open, you barely notice the difference between the two eyes for far and near. And even after a few years after, we always say that the effect's about 5 to 10 years, but few years after, if you need a retouch, you can always do it, especially those that we have done LASIK on. We just lift the flap and do a retouch and give you back your near vision as well. So we can add on to the near vision. Usually the near vision is the issue a few years after, so we can retouch and give you back more of the near vision. Next slide. So basically, the laser, you know, briefly and basically makes your central cornea the near zone and your peripheral the distant zone. So it requires your pupil to adjust to this new system of the eye. So your pupils have to constrict when you're watching or when you're reading, and it has to dilate when you're seeing distant vision, and that takes time. And usually about 2 to 4 weeks before your pupils and your brain to adjust to the new situation. Next slide. So what to expect? Again, 2 to 4 weeks adaptation. So we have patients here who have done it last week or 2 weeks ago. They're still improving and adapting. So it will get better in the next few weeks, next few months. It has a higher enhancement rate. So for those who still need more distance, more reading, you can go back to the laser. I've done it with one of our patients, and we did the enhancement, and the next day he was seeing better for near. And few that's done after only minimum of 4 to 6 weeks. So we cannot do a retreatment less than 4 to 6 weeks, because we need full adaptation to the new to your PRESBYMAX LASIK. Only after 6 weeks that we can do a retouch if needed. So next slide. So here are some examples. Here's a case of CB as a 49-year-old female. She was very, very myopic. She was the wife of a friend. And her grade was 200. She was 49. So when we did full correction, we needed to add 200 so that she can see near. So we did PRESBYMAX LASIK, and we hit the nail on the dot. No? She was seeing 20/20 with her right eye, and her left eye was the one seeing for near. And she was very happy. No more glasses. She can see near. She can do computer work with no more glasses, and see far as well, especially the far with no more glasses. Another case, TT, 47-year-old female. She was farsighted, plus 200 with additional plus 150. She was wearing contact lenses, multifocal contact lenses, and she was tired of these contact lenses. She came for PRESBYMAX LASIK, and again, she was very happy. Same results: right eye far, left eye near, and she says she has never seen better vision since 5 years ago when she was younger. She was in her mid 40s or 47. Next slide. Another friend, DR, 50-year-old male. The only problem was reading. So he had no problems with far. He said, Dr. Chess, I just wanna regain my reading distance. So without glasses. So I did one eye only, the left eye, and we hit the nail again on the target. Her left eye was minus 175, and now he can see without glasses. Even the next day, reading, texts, YouTube videos, and he's very happy. And he's gonna be like this for the next 5 to 10 years. So with that, this is our clinic. So we invite you to come to our clinic. We are open Monday to Saturday. We're at the second floor of the SM Mall of Asia. For those who are interested, you can come for screening, and we will recommend what is best for you. So you can see here, yeah. So these are our phones and our cell phone, and you can easily contact us through our Facebook page at Boro Center for Sight. There is a message box there. Just send your information, and we'll be glad to call you and schedule your screening. You're open from Monday to Friday, the whole day, and Saturday half day. So at this point, thank you very much for your kind attention. At this point, we will accept some questions. Mitch, do we have some questions from our participants? Dr. Jerome, what are the usual questions for patients who are contemplating on LASIK?
Yeah, most people would say, Doc, what if I have a cataract and let's say I have PRESBYMAX LASIK, what can you do with my cornea? And I decide to, in the next couple of years, and I want those fancy lens implant. What does your laser able to do?
Yeah, as long as the effect on your cornea is still okay, your corneas are still multifocal. So when the time comes that you need a cataract surgery, then most likely you will only need a monofocal lens. So with a monofocal lens, which is the ordinary lens, just one distance, and with a multifocal cornea from your PRESBYMAX LASIK, you should be able to see, comfortable reading, comfortable intermediate and far vision after your cataract surgery. So during your screening, we measure your axial length. We do a full screening. We measure your biometry. We call it a biometry. So that when the time comes that you develop a cataract, we have the information. It's going to be easy to pick the right lens for your eye.
Dr. Chess, we have a few questions here. So the first question is from an anonymous attendee. The question is, does having LASIK increase the chances of keratoconus?
I'll let our cornea specialist answer that. Doctor.
That may be true, but we do a very thorough screening at the center, and we have the most modern machines to check your eyes. We do what we call a wavefront or the aberration of your eye, which are the corneal irregularities. We check that. We also do corneal topography using the Schwinn system, which checks very early changes and checks for keratoconus. So if there is a slight question for having a suspicious keratoconus, then we may offer trans PRK instead of doing LASIK. So in our hands, we have never had keratoconus because we screen our patients very thoroughly. And of course, we also do sophisticated dry eye evaluation. So in the dry eye evaluation now has become so significant and important, and we have all the toys, the bells and whistles in the clinic to check your eyes for dry eye as well.
Thank you for that answer, Dr. Jerome. Next question, does LASIK hurt during the procedure? And after LASIK surgery, do I get blurry vision at first?
Chess, you want to do that?
The patients do not, after the LASIK procedure, they say they didn't feel anything. Of course, your eyes are numb with topical anesthesia. So from start to finish, we make sure that the patient is comfortable. They don't feel anything. So if they do, then we add more anesthesia. But based on the large population of patients that we've done LASIK to, no one ever really said that they felt anything during the procedure. Right after the procedure, when the anesthesia wears off, then they can feel something like a foreign body sensation, like something's in your eye, a little tearing. It really goes away in a couple of hours, a few hours. So when the eye really heals very fast, especially the next day, they no longer feel anything, and the vision should be much improved by then. And the other question was, Mitch?
We have another question. Is dry eyes a major contraindication for LASIK? And does this mean that when someone has dry eyes, he or she can no longer undergo LASIK? This question is from Marielle.
Thank you for the question, Jerome.
Yes,
Dry eye specialist.
yeah, yeah. If the dry eye is like significant, like let's say we grade the dry eye from mild, moderate to severe. So let's say your dry eye is severe, then probably it will we will offer trans PRK or trans LASIK for you if you're young. Now, if you are a contact lens wearer, probably contact lens is the probable cause for your dry eye and would probably put you on contact lens holiday. And at Borough Center for Sight, we also offer the implantable contact lenses if you're young. But if you are in the cataract age, we might as well what we do refractive lens exchange or an earlier cataract surgery. So we have many options at the center, and we would choose the right procedure for you. Does that answer the question?
Thank you for that, Dr. Jerome. Any other questions? Feel free to type it in the Q&A. Another question from Veronica Garcia. After a LASIK procedure, can I resume work? My job involves 8 to 10 hours of computer work.
Yeah, I mean, we just ask you to rest the day of the surgery, and then when you wake up in the morning, just continue the eye drop. You're back to normal activity. If we do it on a Friday, most likely you're back to work on a Monday, and vision maybe not yet 100%, but you should be very functional already. We don't restrict our patients too much, maybe 2 to 3 days, but they're free to do whatever they want once they feel that their vision is almost there. It should be there in the next in 24 to 48 hours.
Yeah, it would also help. We have our wives, our nephews, nieces have we've done surgery on them, whether LASIK or trans PRK, and ourselves. Actually, I had PRK myself way back many moons ago when I was. This was like 25 years ago, and of course, if you hit 40, no exception. Dr. Ches said that once you're 40, there are lens changes. And it's just unfortunate that there are some aberrations in my eye based on my initial screening. Hence, I cannot do PRESBYMAX trans PRK or or PRESBYMAX LASIK. That's why you see me wearing glasses. But Dr. Heredia is lucky because his eyes are what we call virgin eyes. So he was qualified and underwent and had successful trans PRK. So going back to the question, when I did my wife, of course, your wife, right, LASIK, the most difficult patient to do is your commander-in-chief, right? so she LASIK after a couple of days, if I recall, maybe a day or two, she was up and about, and I wouldn't hesitate to recommend LASIK or trans PRK to any of our patients.
Do we have time for one more question, Mitch?
Last question. Anybody? All right, I think that's it for the Q&A portion. No more additional questions. So thank you everyone for attending this talk today. And now the moment that everyone has been waiting for. We will be announcing the raffle winner for one voucher of 20,000 pesos off of LASIK or PRESBYMAX LASIK. So I'll now be turning over the floor to Mike to announce the winner of the raffle.
Wow.
Mike ready? Or are they still raffling off?
I think he may be organizing the raffle. Let's check.
So you guys stick around and the lucky winner. It's your chance for LASIK. May just be today.
I think it is also important that with the pandemic, why choose Borough Center for Sight? Well, we are not hospital-based. It's a mall-based, so there's a stringent policy on checking the temperature, and there are no sick patients to begin with at Borough Center for Sight, and parking is quite excellent. So, I mean, I've been to many hospitals. I think Borough Center for Sight is one of the best places to be for your eyes because of convenience and safety, as well as expertise with the staff and as well as our surgeons.
So I think we have a winner, Doc. The name of the winner is Ana de la Rama.
Ana de la Rama.
Congratulations.
Congratulations, Ana de la Rama, for winning a voucher. So we will be emailing you the details. Congrats, and thank you everyone for joining this webinar. We hope you enjoyed and learned something new today.
Thank you, Dr. Jerome.
Thank you, everyone. Thank you.
See.
Thank you, everyone.